is Dr. David Wu, followed by Jennifer Rodriguez, followed by Freddie Kelser.
Good evening, Board. My name is Dr. David Wu. My medical practice is located in the city of Chino. I've been a family chiropractor for over 30 years. Over these many years, I've seen my share of pain, sickness, and disease due to health choices, some good and some bad. Yes, we're a free and responsible people, aren't we? What we're facing today, the mandated COVID injection, is no longer a choice, but it strips away our conscience and freedom to choose for our bodies what is right and what is wrong. There's a Bible verse that depicts the heart of God for the vulnerable, the children. Matthew 18:6 says, "But whoever causes one of these little ones who believe in me to sin, it would be better for him if a millstone were hung around his neck and he were drowned in the depth of the sea." What's happening to children when they're exposed to these experimental injections with unknown ingredients? When the body detects dangerous toxins, it's like giving a child alcohol. Inflammation occurs, leading to a hyperimmune response in the cells, compromising all your vital organs. These injections are not only failing, but they're putting lives at risk. According to VAERS, our vaccine adverse effect reporting system, currently we have in the US over 16,000 deaths and climbing, 23,000 disabilities, 10,000 myocarditis cases, for example. Even more, the VAERS system is widely known to underreport events by only 1 to 10% at best. You can add probably 1 or 2 more zeros behind that. Probably total 1.5 million deaths at most. So myocarditis, let's take for example, is inflammation of the heart, which can lead to chest pain, shortness of breath, abnormal heartbeat, fatigue, heart attack, and eventually heart failure, stroke, and death. Since these injections have started, there's been a 200% increase in myocarditis. So the COVID injection is basically a blood clot shot. Based on safety and risk of death, this mandatory injection program should have been shut down already by February 2021. 8 months later today, are we still mandating this program and giving it to our children? Why? It's insanity. Realize this, once there's damage to a heart cell, it's replaced with scar tissue, and it's damaged forever.
The next speaker.
I'm not going to speak again because I spoke already, but I want to give my time to the doctor. Please continue. I had my mom's friend that had to leave, so I fill out their time. So, or anybody that got cut off, please. Do you want to finish?
I really didn't have much more. I mean, there's so many passionate parents here. I like to say that I've lost some patients in the last 6 months. So have my colleagues to COVID, getting the jab and all of a sudden a heart attack here and there. It's not a coincidence. And it's going to happen more and more. It's just a matter of time. So this is wonderful that we all get to speak our mind and have the freedom to express our experiences. And my boys have graduated already. I'm doing this for the children of all my patients and I see all the parents here, and I'm doing this for you. Not much more to say, but really hope that we're just open mind and our hearts are open to really hear what every person is expressing here as they come up here. Realize this, I wanted to finish this, is that once there's a damage to the heart cell and it's replaced with scar tissue, it's damaged forever. And the same thing goes for all the other cells. And what happens when this inflammation happens, hyperinflammation, and blood clots keep occurring to the other organs? Then you got your liver, your brain, your kidney, your reproductive organs. It's just a matter of time. It's going to consume the health of every child. So what we have to ask ourselves is, what are we going to do? Are we going to do what's right or wrong for our future generation? Thank you.